Hello, everyone, and happy Friday. My name is Chelsea Croningold, and today I am chatting with the incredible Gloria Lucas about eating disorders harm reduction and why it is important for marginalized communities. If you're watching this live, drop a hello in the comments section so we know you're here. And if you have any questions, we will do our best to answer some at the end. So Gloria is an eating disorders awareness activist that specializes in intersectional eating disorders education and resources that transforms the lives of Black, Indigenous people of color and expand eating disorders treatment models. Being the founder and CEO of Nalgona Positivity Pride, Gloria is able to raise awareness through digital media, public speaking, and grassroots activism. Hello, Gloria. Thank you for joining us today.
Thank you for having me.
Our pleasure. We're really excited about this topic, so let's just dive right in. So, what is harm reduction and how does it apply to eating disorders?
So, harm reduction rose in prominence in the 70s and 80s in response to HIV and hepatitis B. So, harm reduction are policies, programs, and practices that aim at reducing the adverse, negative health, social, and economic consequences of health behaviors without necessarily extinguishing the problematic health behaviors completely. So, in the context of substance use, harm reduction disentangles the notion that drug use equals harm and instead identifies the negative consequences of drug use as a target for intervention rather than the drug use. And some harm reduction strategies include syringe exchange programs, which have proved to be effective in reducing the spread of HIV and hepatitis B, safer injection facilities, which have helped prevent overdoses, help prevent dangerous litter in communities, and overdose prevention programs and policies, as well as opioid substitution treatment. Now, when it comes to eating disorder harm reduction, this is more of a grassroots, compassionate model of care consisting of practical, easy strategies and ideas aimed at reducing long term health consequences as well as eating disorder symptom management. Now, what people should know is that eating disorder harm reduction, it's not in any way encouragement for an eating disorder, but it actually supports any positive change as recovery. And it meets people where they are at. So nobody's left out. It could help reduce depression and anxiety associated with concurrent or associated with the eating disorder and provides dignity and autonomy and a voice for those with eating disorders. And more importantly, it could help reduce suicide because it allows a quality of life that is more acceptable and therefore provides hope for the future.
Absolutely. It takes away that black and white thinking of what recovery is and kind of gives a space for that compassion and that progress, as you mentioned. Wonderful. So, how does this apply to marginalized communities specifically or especially?
Well, we know that eating disorder treatment is can be very difficult to have for anybody. But when
Yes.
it comes to marginalized communities, I mean, we're looking at a community that's underserved and is impacted by discrimination or outright racism, transphobia, you name it, and on top of financial and healthcare barriers. Now, marginalized communities also don't always have the support that they need from family and community in order to continue with recovery or to even start recovery. So, harm reduction methods are actually accessible, easy, and affordable. And like I mentioned earlier, it meets people where they are at. And it is a non judgmental approach. And it might be the first introduction to care for a lot of marginalized people. I know in my case, harm reduction is what's keeping me afloat right now. It provides me effective and immediate um, relief in order to continue living my life and continue doing this line of work. So to me, it's something that's very valuable and personal.
Sure. And, going off of that, so you're saying right now harm reduction is really helpful for you. And I think that a lot of people who are trying to maintain recovery or strive towards recovery while we're in the middle of this global pandemic are also, figuring out how can I just make that a little bit of progress as we're talking about. So how does this apply specifically to COVID-19, the idea of harm reduction in terms of eating disorders or just in general?
Right. We have seen a spike in people with eating disorders struggling. And, what's good about eating disorder harm reduction is that it is a compassionate model. And I think that right now many folks are at home and maybe needing structure or whatnot or in-person care, but harm reduction are things people can do at home, that are over-the-counter things, and so these strategies can also be used alongside professional treatment, right? It's not one or the other; they could be combined and be done at home to help alleviate and just make life a little bit easier.
And do you have some examples of harm reduction in terms of eating disorders? I know you talked about some substance abuse options.
Yeah, so I actually did the webinar last night on this subject, and what I cover is dental care as well as gastrointestinal care for folks who have digestive issues due to their eating disorder, as well as supplements that could be used. Obviously, checking in with your provider or doctor first, over the counter, that could help with sleep, improve sleep hygiene, because we know people with eating disorders have more disruptive sleep. So, and I mean, amongst other things, such as what to eat to not have your potassium drop too low, and so yeah, it's a lot. It's a lot of information, but again, it's helpful, and it just gives you more energy throughout the day and the support that you need.
Yeah, and it's great that there are so many options because I'm imagining what works for one person might not work for somebody else. And so there's different ways to approach harm reduction.
Yes.
Thank you for that. So, what can viewers do to help marginalized communities receive the support they need for their eating disorders?
I think becoming more comfortable and actually welcoming non-dominant models of care. Uh-oh, we froze.
I think we're back.
Okay, I don't see you no more, but there we go. You're still frozen, but can you hear me?
I can hear you.
Okay. So I think becoming more comfortable and welcoming non-dominant models of care, and actually hearing what people, particularly marginalized people, are saying when it comes to the gaps in treatment, the lack of diversity, and so forth. But more importantly, including other worldviews in treatment, and push for more care that centers marginalized people instead of being inclusive, actually centering marginalized communities. Because for the past 30 years, it's been the same narrative, the same over and over. So it's time to make room for others. Also supporting grassroots eating disorder awareness efforts. We have an online peer support group that's held once a month, that is completely free, that is specific for Black, Indigenous people of color. So supporting other grassroots efforts as well.
Yeah, it's so important to be able to find community within this eating disorders community because it is isolating. And to your point, there has been this traditional kind of model or standard that they've been using. And it's important to be sure that we're reaching marginalized folks in ways that is effective for them. And so you mentioned that Nalgona Positivity Pride has a weekly support group. Would you like to share any more information about the organization, how folks can find you, get involved, anything like that?
Yeah, so folks can follow me on Instagram. That is where I'm most active at Nalgona Positivity Pride. I know it's long, but so that is where they can find information. They could also visit my website for upcoming events. I'm hosting a lot of webinars during this time that are essentially including indigeneity, thought, and spirituality into eating disorder healing. And so I have two upcoming webinars on that subject that all are welcome to attend.
And they can find that on your website, you said?
Mhm. Yes,
Awesome.
Instagram as well.
Instagram too. And we will be sure to tag your platforms on the appropriate platforms, tag your handles. So, well, anyway, any closing thoughts or anything else that you want to share with our community before we wrap up? This has been such an amazing conversation. I think, I'm personally a huge fan of harm reduction, and I hope that it opened up, that possibility to other people who maybe are hearing it for the first time or have been reluctant to, move forward with that sort of model. So anything else?
Just letting folks know, particularly if you're coming with with a low income background, you're a Black, Indigenous, or person of color, queer, trans, fat person, or person with disability. Just know that you're not alone. That we have healing properties within us. We have community, and that we are taking care of each other the best that we can. So don't think that you're alone.
Yeah, that's a beautiful message to end on. You're definitely not alone. Well, thank you so much, Gloria, for joining me today. Thank you, everyone who's watching. Hope everyone has a great weekend, and we will be back with you next week for more NEDA Connections. Bye.